Well, imagine waking up and being bedridden, unable to walk or sleep due to crippling pain. For Anne-Marie Raymond, this was her reality, struggling with severe back pain that many professionals chalked up to being a mum.
Well, after years of pushing and searching for answers, Anne-Marie finally received her diagnosis of axial spondyloarthritis. But that was just the beginning of her journey, and Anne-Marie joins us now to tell us more, along with Medical Director of Arthritis Australia, Professor Susanna Proudman. Good morning to you both. To you first, Anne-Marie, if I can, when did you first realise that your back pain was more than just, being a mum?
Well, I'd had the pain since I was in my late 20s, and it kind of disappeared and then came back again after my children were born. And often I would just dismiss the pain, thinking it was because I'd been pushing the pram uphill or carrying a toddler on my hip for too long. But the pain really persisted and escalated, and after a while I did reach that point where I wasn't really able to get out of bed, and functioning and doing the things that I had to do as a working mum with two small girls became really difficult. So it was at that point that I kept going back to my doctor and saying, I don't think this is normal. I think I need some more help. I need to find out what's going wrong.
And once you were finally diagnosed with AS, you were prescribed medication, but it didn't take away the pain, right?
It did initially. It was just blissful at first because suddenly I was able to sleep and feel a bit more normal. But after a while, the pain overwhelmed the medication again, and also brought with it some more difficult side effects. So my digestion started to cause me problems then. And I realised that what I had thought was going to be a great solution and get me back to my normal life was actually it hadn't solved the problem completely. Yeah.
All right, well, let's bring in Susanna on this. A lot of women in their early 40s, wouldn't have arthritis front of mind if they're experiencing back pain. Is AS arthritis often misdiagnosed?
Well, we've learnt in recent times that axial spondyloarthritis, and the most typical form of that is ankylosing spondylitis, is much more common in women than previously thought. It was thought that it was mostly a condition affecting men. So women presenting with pain might actually be thought to have common non-specific low back pain, for example, after pregnancy or due to sort of ongoing muscular issues, which affects about 10% of the population. Whereas we now realise that women are much more likely to have this than previously thought.
Yeah, explain that, Professor. Why do women in particular have such a tough time not only receiving a diagnosis but also finding a treatment that works?
Well, I think everybody with an axial spondyloarthritis certainly goes through a phase where they have significant, what we call inflammatory low back pain. That involves a lot of stiffness that lasts well over an hour after periods of inactivity, first thing in the morning and often at night, needing to get up in the middle of the night and do stretching exercises just to get relief. And because it's not expected to occur in women, the diagnosis might well be delayed. And there is also a phase of needing to treat these conditions with non-steroidal anti-inflammatory drugs, which whilst certainly effective in controlling symptoms, there are actually more effective drugs that can control the symptoms long term and prevent the damage due to the inflammation. So if patients become eligible for that, they can get treatment over a period of time, but it is a process getting to that stage for both men and women.
Well, Anne-Marie, you've made a lot of big changes to your lifestyle which have made a huge impact on your level of pain, even devoting your career now to helping others to do the same. Tell us about the lifestyle changes you've made, the ones that have worked for you.
Yeah, well, initially trying to resolve the digestive issues that I had, I made a lot of changes to what I was eating. I'd learned a lot of gut healing strategies, which were fantastic. And then in time I realised that that was also helping with the back pain symptoms as well and reducing my inflammation. So learning to move my body, so doing specific types of stretches and yoga for AS. Also learning to manage stress. Stress has a huge role to play in inflammation. So all of those things, just small changes adding up bit by bit over time to really affect the big picture made a difference to my pain.
Well, you're bringing a lot of awareness to the issue and no doubt support to a lot of other women out there as well. We appreciate you both joining us this morning. And to learn more about axial spondyloarthritis, you can head to myas.org.au.
What a tough time she's had.